Our last speaker for this session is Dr. Waseem Shahani from NIBD. He will be delivering a talk on impact of bone marrow fibrosis on outcomes of CML with second generation TKI.
Assalamu alaikum. This is Dr. Waseem Shahani from National Institute of Blood Disease in Bone Marrow Transplantation. First of all, thank you, and I appreciate the opportunity to provide an abstract today that is on the impact of bone marrow fibrosis on the outcome of chronic myeloid leukemia that is treated with the second generation tyrosine kinase inhibitor. So I have no conflict of interest. So chronic myeloid leukemia is a hematopoietic stem cell disorder that accounts for 30% of the incidence of adult leukemias, characterized by the BCR-ABL oncogenes gene leading to the increased tyrosine kinase activity. Tyrosine kinase inhibitor have dramatically improved the CML prognosis with a life expectancy now comparable to the general population. The annual incidence of CML varies between 0.4 to 1.4 individuals across different countries. So bone marrow fibrosis is seen approximately 40% of the newly diagnosed CML patients and is traditionally considered the adverse prognostic factor. In a study conducted at the King Edward Medical University, Lahore, Pakistan from March 2015 to 2017, the grade 2 fibrosis was observed in 27% of the patients and grade 3 fibrosis was seen in 8%. Despite the significant incidence of the CML in Pakistan, challenges and outcome in this context are under-researched. So this was the rationale behind this study to evaluate the impact of bone marrow fibrosis on the clinical outcome of CML patients treated with the second generation tyrosine kinase inhibitor, nilotinib. So this was the longitudinal study conducted at the NIBD and BMT from October 2018 to 2023. And total patients included 150 with age 18 to 80 years of either gender diagnosed with CML CP, previously and newly diagnosed on the treatment second generation tyrosine kinase inhibitor. CML with accelerated and blast phase were excluded, and bone marrow biopsies were performed at the baseline and graded according to the WHO criteria 2016. Outcomes were evaluated at the 3 and 6 months of treatment using a complete blood count and PCR testing, including the clinical signs and symptoms to document the complete hematological and molecular response. So this is the ELN recommendation definitions accordingly. CHR, complete hematological response, was defined as a WBC count of less than 10,000, platelet count of less than 450, absence of immature cells in the peripheral blood, basophils less than 5%, and absence of splenomegaly. While the molecular response was defined as a reduction in the BCR-ABL transcript level less than 1% at 6 months of the treatment, and treatment failure was identified in patients who did not achieve BCR-ABL less than 10% at 6 months or who did not achieve complete hematological response at 3 or 6 months of the treatment. So this is the showing our median age of 43.5 years of the total 150 population, and with the male predominance of the 60.7%, and we divided in two groups, low grade and high grade fibrosis. A low grade 0 to 1 fibrosis that included 68.6% of the patients, and high grade 31.3% of the patients. This is the main pictorial diagram of the outcome of the CML patients treated with second generation TKI. We evaluated first at the 3 months for the CHR, complete hematological response, and we found that the CHR was higher in the low-grade fibrosis, that is 73.5%, in comparison to those patients who had higher grade of fibrosis, 66.7%. Similarly, and molecular response at 6 months, we found higher in the low-grade fibrosis in comparison to the higher grade of fibrosis. So at 6 months, we also noted there's drug-induced myelosuppression and leading to the treatment disruption and discontinuation temporarily, with the percentage higher in the higher grade of fibrosis, that is 33.3% in comparison to patients with the lower grade of fibrosis. So coming to the optimal response, overall, we found that all the patients who had an optimal molecular and hematological response at 6 months, that was also higher in the patient with the lower grade of fibrosis, 77.4%, in comparison to patient with higher grade of fibrosis, that is 56.2%. So discussion, present study revealed comparable results in terms of frequency of higher grade of fibrosis, that is 32% of our study, that is comparable to the published national and international studies our national study from the King Edward Medical University, and international the contribution from the, it was from MD Anderson and the Tandikulu from Italy. In our study, AMR was achieved in 64.7% of the patients with low-grade fibrosis, while 50% patients with a higher grade of fibrosis at 6 months. Furthermore, drug-induced myelosuppression was observed in 33.3% of the patients with a higher grade of fibrosis in our study, while when we are comparing this study to a published study in the Ash Blood Journal in 2018 from India, out of the 147 available 92 patients, they found that the patient with the lower grade of fibrosis with a higher MMR, major molecular response at 1 year, 48.8%, in comparison to those patients with a higher grade of fibrosis, that is 26.5%. And additionally, they also found the drug-induced suppression of 29.3% and higher grade of fibrosis. So bone marrow fibrosis is a critical factor, concluding that influence the response to second-generation TKI and CML patients. And lower grade of fibrosis correlate with a higher response rate, better clinical outcome, suggesting the importance of early intervention, tailored treatment approaches, and patient education for frequent monitoring based on the fibrosis grading. Though we have some limitations of the study, that it is a single center study, paucity of the long-term outcome beyond 6-month follow-up, and no comparison with the first and second generation TKI was seen. Thank you.
Thank you very much, Dr. Shahani. With this, we come to the end of this free paper session. We are highly obliged to the worthy panelists as well as the speakers for the excellent talk.
So are there any questions if someone want to ask?
So I think the next session is at 12:30. Sir.
Because वो कुछ से हुए कुछ
Okay.
Dr. Shahani, very good presentation. Just want to ask, did you look into any other variables in those patients having high fibrosis,
No, we have
like cytogenic abnormalities, JAK2, etc., etc.?
This is the initial evaluation at 6 months. We are following these patients, and we will follow them. In next 6 to 12 months, we will update another study related to this that will include the cytogenetic and risk stratification along with that. Any question? I'm happy to take.
The results will be announced after the thrombosis session. Thank you very much.